Well, welcome everybody. We're filling up the little squares nicely. Thanks for coming. Welcome to another event in the series on global governance in the age of COVID that's organized out of the Weinberg College Center for International and Area Studies at Northwestern University. All semester long, we've been commissioning contributions and hosting events from experts in law and policy and medicine and public administration and other fields, all talking about how the COVID epidemic has revealed things in their field, in their research, that helps us to better understand where we're at, where we've come from, and where we're going. So today, I'm really happy to have with us Professor Linsey McGoey, who's a professor of sociology at the University of Essex in the UK. And she's spent her career studying how societies are shaped by the power of corporations and how the power of corporations is enabled by the choices of governments. And so at this intersection between corporate power and modern state governance, she's among the most astute commentators on the blurring lines between public and private authority, states and market power. And that puts her in the grand tradition of economic sociology, from Marx to Weber to Lindblom, and also at the cutting edge of thinking about our contemporary situation, since it gives us a lot to think about our age of oligarchs and extreme inequality and the forms of governance that follow from that. Her first book was called No Free Gift, The Gates Foundation and the Price of Philanthropy. And that charted how these huge foundations like the Bill and Melinda Gates Foundation have taken on social welfare functions and maybe even policy-making roles and the costs that follow from that. And this is all the more current because obviously this year the Gates Foundation's become such a prominent facilitator of vaccine research and distribution, and also a big player in the World Health Organization. So Linsey, welcome. Thanks so much for making the time to be here. So you've been paying attention now for a long time to the rise of these philanthropic foundations. What brought your attention to these entities in the first place?
Yeah, thanks, Ian. And thank you so much for that really generous introduction. And I really love this format where we're just asking questions. And I'm hoping that too, it's going to be great when we have the audience discussion portion of it, because I'm really looking forward to hearing your thoughts on how we can make sense of this, in some ways, very unprecedented times. But how I first got interested in philanthropy, and I was specifically interested in this new term that had come about in a sort of 2006, called philanthro-capitalism. It was quite a long time ago, actually, really. It was 12 years ago. And I had just finished a PhD at the London School of Economics, which actually looked empirically at pharmaceutical regulation. So maybe that's a topic that will come up a bit later, because I think we've just seen some of the quite terrible nationalist, triumphalist attitude of the British government for sort of managing to fast track approval of this Pfizer vaccine. Or sorry, it was the Pfizer BioNTech vaccine that they've approved. But we can maybe come back to that. And then as maybe some of your, if there's any graduate students or more recent faculty in the audience, once you finish a PhD, you're sort of canvassing around for your next main empirical project. And I happen to have been lucky enough to get a 2-year postdoctoral fellowship at kind of strangely enough, because I was quite critical of business, but it was at the Said Business School at Oxford, where they wanted to bring on some more sort of critical economic sociologists in order to, I guess, maybe look at some of the more negative sides of sort of unrestrained corporate regulation, and particularly my work on pharmaceutical regulation seemed to therefore be fitting for this postdoc. And while I was there, I was sort of confronted with this new emerging paradigm in management, which was this notion of shared value, which is the idea that corporations should try to align their core competencies with their charitable work in order to sort of make money by doing good socially. So the idea that you can combine the effort to do well and to do good. So to do well for various social objectives, as well as to sort of profit financially. And this was also sometimes being referred to as philanthro-capitalism. And the Gates Foundation was being upheld as a sort of champion of this new model of exactly what you've just described, the sort of blurred line between profit making and public welfare. And I was very critical of the idea that you could align profit making and public welfare as easily as some of these management theorists were suggesting. So I set out to sort of study it by looking in particular at the Gates Foundation.
And then what did you find?
Well, I mean, I found many things that were very interesting at the time. And I think it's strange to look back 12 years ago at this. And I studied it. I did about 55 qualitative interviews, which maybe, I mean, by some measures, that's not a huge number, but by others, I did get some fairly good access to places like staff who are working at the World Health Organization, staff who were working at the World Economic Forum's Geneva office, people who were really at the forefront of this new, let's marry private profits with public purpose agenda, as well as a couple interviews at the Gates Foundation before they sort of shut down my access. Unfortunately, they were all done via Skype at the time. I didn't get access to Seattle. By the time, at first, they were sort of open to me going there. And then I think they started to realize that I was asking slightly more critical questions than they wanted. So my access was shut down. But what I found was that, and I tried to be, and then eventually I published these findings in a 2015 book. And what I found, first of all, that really amazed me, it did surprise me to a certain extent as a sociologist, sociologically speaking, what I found was enormous fear and trepidation about angering any of the executives at the Gates Foundation. So whereas I could find many scientific experts very willing to criticize the World Health Organization, as well as various government actions and government actors, people were very reluctant to criticize Gates. And I came to know and hear about this term that they called it, different activists and policymakers called it the Bill chill effect, where they said, if you irritate Bill in some ways, then you might freeze out the possibility of you deriving funding for a public health initiative that you feel really passionately about. And that's not because Gates funds everything, but he funds enough global health initiatives, for example, that unless you have the imprimatur of the Gates Foundation's approval, other organizations might look at you and say, well, why didn't you get Gates Foundation money? Because he funds so much. So people were essentially worried about a domino effect of being seen in some way in the bad graces of this foundation. So I began to see the fear of angering staff at the Gates Foundation as a key sociological conundrum in itself, because I thought it might be essentially a pillar of poor science and a pillar of sort of a monopoly of knowledge production that meant that people were not able to speak truth to power in ways. And this might lead to sort of scientific silos and to the type of silencing effect, which is never a good aspect of science and open science.
As a research strategy, that sounds pretty clever. So to notice those places where people are afraid to talk about something or afraid to anger some power, that seems like a pretty good clue that there's something there worth looking into.
Yeah, I think that's a great point, because what some of the people I was trying to speak with, I mean, these were often natural scientists. These were people who were particularly working on neglected disease research. So funding towards infectious diseases that affect a large proportion of the world's population, but there's not a lot of money in funding treatments for them. And so there's not a lot of will on the part of pharmaceutical companies to put money towards therapies or treatments. And in this way, I really salute the agenda or the mission of the Gates Foundation is obviously a laudable one to improve global health. But very explicitly, the Gates Foundation adopted a very openly pro-market attitude towards its global health initiatives that I thought at the time were displayed a sort of myopia towards recognizing that markets can often be good for some types of development and exchange, but they can also militate against the type of regulatory needs that can help to ensure that corporations don't harm the public, or that they don't price gouge when it comes to pharmaceuticals, for example, or that they don't treat their workers in a predatory or an exploitative way. So Gates was just never really cognizant of the fact that his aim to, as he explicitly put it in a 2008 speech, to stretch the reach of market forces globally could have unintended effects that he simply didn't seem capable of perceiving, like leading in some cases to increased indebtedness, like leading to privatized healthcare systems that really led to costs being shouldered by governments in ways that you see, for example, in the United States, that has a very costly healthcare system with, on average, often poorer health outcomes than nations that have, subsidized Medicare for all. So instead of trying to improve some of the problems with private healthcare in the US, he largely focused on exporting that model elsewhere, which has been problematic in many ways.
I want to get back to your business school origins there, as you described a kind of business school rhetoric about essentially making more money by doing good for corporations. That feels a little bit broken off from what I understand the foundation's rhetoric to be, which is really about problem solving, technocratic problem solving. Here's a big problem, let's get smart people to deal with it, and we'll move on. So do you find that business school rhetoric, the corporate do-gooder rhetoric, to be infusing the problem solving aspect of Gates Foundation public health?
I really do in many ways. And so let me expand on this and sort of try to describe my evidence base for this in more detail. So I think where Gates himself has been quite explicit about this rhetoric. So essentially, in a speech that he gave at the World Economic Forum in 2008, he made it quite clear that he sees value in trying to stretch the reach of market forces. That's a direct quote from Gates, and to find ways to allow companies to gain profits or reputational advantages from doing work that eases the world's inequities, okay? So he has been explicit about the aim to find a way to marry the effort to create more social value with the effort to create more profit. And this is why sometimes I find it problematic today that some people at the sharper end of conspiratorial thinking say, oh, he's trying to profit. I don't think he is personally, but I think he has been explicitly sanguine about helping other companies to profit from different types of public health delivery or different other types of public procurement in ways that has had actually pernicious effects. So he didn't use the phrase shared value. He calls it creative capitalism, and he was always explicit about this aim of creative capitalism, as he calls it, to find ways to incentivize companies to do more good. Let's talk for a minute about why this has actually created unintended effects. Because where in contrast to an organization like I said, the Koch family foundations, which stems from the Koch family fortunes, and where you've got an explicit ideology of trying to increase corporate power and lower regulations. Gates is not, I think, in any way on the right wing of the spectrum like an organization like the Koch family foundations. And I don't think, unlike Koch family foundations, unlike the Walmart family fortune, where you actually see a lot of philanthropic money really going to initiatives that might favor their own business interests directly. I don't see that same connection with Gates, but I do see him thinking that incentivizing companies will inevitably lead to positive effects. And I think this has unintended effects of really dramatic proportions. And let me explain why for a minute. And to do so, I'm going to go back to sort of the rhetoric that Gates is trying to push against, and to show that really that effort, I think, came from a magnanimous aim on his end. It came from a positive place. Where I think Gates was trying to challenge, what I think he was trying to challenge, is the narrow shareholder maximization profit ideology of earlier thinkers like Milton Friedman in that famous New York Times Magazine article, where Friedman says the responsibility of business is to maximize its profits. I'm paraphrasing the title there, but that was the title of Friedman's article. And Friedman, in that article, was very explicit about the fact that corporations have a fiduciary duty to shareholders, and they should focus exclusively on that duty. And he actually sort of quotes a passage from Adam Smith, where in Wealth of Nations, Smith says he's always been suspicious of companies that affect to trade on behalf of the public, because that's a way that, sometimes actually Smith's meaning was that was a way that business people could sometimes strategically veil their self-interest in ways that could be pernicious for the public good. That was actually Smith's meaning. Friedman takes it, and he said Smith was right about this. Companies should focus on the bottom line, not on social purpose, because if we hand them the reins to engage in social purpose, this might entail more democratic oversight over their operations, and we don't want that. So Friedman didn't shy away from the social purposes of businesses because of simply some sort of cold-hearted ruthlessness. He shied away from it because he thought it might entail more democratic oversight of corporate activities. Unfortunately, then I think people like the shared value thinkers who are Mark Kramer and Michael Porter out of Harvard Business School, as well as then people like Bill Gates came along and said, oh, no, Friedman's wrong. We can incentivize companies to do more social good. We shouldn't be restraining their work on behalf of the public. Let's incentivize them. But that never came together with a concomitant enhanced regulation that Friedman actually feared. So we've now got the worst possible worlds. So we have corporations doing more than ever to sort of position themselves as well-placed to receive public procurement contracts, for example, to do things like run prisons, run healthcare systems, all types of activities that in the past they did not do as extensively, or at least there were more restrictions on them doing, without the same democratic oversight that Friedman feared. And I think Gates doesn't realize that by giving companies a bit of a free license to get more involved in different public procurement policies through public-private partnerships, he's actually positioned them to have more clout and power than ever without sufficient regulation.
So I should actually remind everybody that we'll open the floor to questions and comments in a little while. So if you've got anything to add, feel free to type it into the chat and we'll pick things up from there. Linsey, you've just, I think, described really well the kind of business school analysis of the vaccines problem, which is that in theory, pharmaceutical companies don't see a whole lot of profit in developing vaccines because it's not a high margin thing. It's not something you take all the time. It's not really a disease of the rich. So there's not a lot of profit in it. So there's therefore not a lot of private sector research in it. And then the Gates logic seems to be to act as an intermediary to fill that market failure by seeding or even just funding outright the kind of research that it's not inherently profitable for these for-profit firms to do. So it's not for-profit status makes it functionally able to do things that the for-profit companies presumably refuse to do. So in that way, it's kind of, if you take for granted the for-profit pharma model, then it's providing this filling function that gets at a gap in the research chain or the production or whatever. So are you saying that is an inherently problematic role, or perhaps that it's got unintended consequences? Or that that the state should be filling the role instead? How do we think?
I think that you should be, if there's a field that's inherently unprofitable, then there could be a rationale for a state-led initiative, which tries to fill that gap and does often fill that gap through a lot of basic research funding, for example, but then tries to do so in a manner that can lead to sustainability, but not necessarily profitability, because the incentive to profit will always trigger a parallel incentive to restrict access in some way, whether through pricing goods more steeply, for example. And if you actually, it's been the whole rationale for, channeling a lot of public goods through the nonprofit sector, because you limit that aim to try to increase an added incentive to gain profits at the expense of something like accessibility for all. So I think there's a big role for basic governmental funding of research, as well as philanthropic subsidies towards scientific advances, for example. But I think it should be built in, you should have conditionalities that insist on contractual guarantees of affordability and access. And my concern with a lot of the ways that the Gates Foundation is giving money to corporations on a really unprecedented scale is that it never asks for these conditionalities that are so essential to ensuring affordability and access. I don't know why it never stipulates conditionalities, but it very rarely does. So it's given money to MasterCard on a non-repayable basis in order to increase sort of what they call financial inclusion across regions of sub-Saharan Africa. And that was because they were really excited about new mobile lending schemes that would increase like little small loans of money that they argued were a barrier to improved poverty, because you didn't have the same sort of Main Street financing options. But just like microcredit, which seemed like a good solution at first, or a panacea for a lack of sort of financial liquidity or access to funding for small scale entrepreneurs, unless such systems are regulated, they can lead to a lot of increased indebtedness for recipients. And so you've actually shot yourself in the foot because you've just managed to enrich a company to sort of quite directly contribute to the problem of growing debt loads across countries like Kenya, where MasterCard has been engaged in some of this mobile transfer work.
So that's super interesting, because it sounds like you're mapping out a political economy terrain that's got firms in it, these private authorities, or sorry, firms, and then public authorities, and then these in-between foundation types. And while all of them exercise power and influence, often through money, they differ in their levels of accountability or their modes of accountability, and also in their responsibility for the unintended consequences of their actions. So it sounds like you were just suggesting there that if we can shift some of these functions from the foundations to states, the states would encompass more responsibility for the unintended consequences than the private actors do.
Well, I think, this is more your area in ways, looking at international organizations and law to an extent, but even, when it comes to who are rights bearers and have a duty to adhere to certain, human rights protection, states themselves are stronger rights bearers. That the buck kind of stops with them. But when states, they don't often fulfill these duties. But this is, again, my worry about transferring too much responsibility to private authorities who have been really quite agile at managing to argue for voluntary forms of compliance, voluntary forms of self-regulation that really aren't working to reduce different types of corporate predation. And we're aware of that. We're increasingly aware of the ways that these voluntary self-regulations don't work, because companies themselves have a sort of inherent interest in increasing profitability as much as they can. And you see this across many of the companies that the Gates Foundation has often enthused about and said we need to enroll these actors in more public-private partnerships. Those same companies then go ahead and engage in really socially harmful behavior. So just to give one example, and then maybe it'd be great to get back to this vaccine discussion, because I think there is this one specific case that had to do with the Oxford vaccine and AstraZeneca that the Gates Foundation has reportedly been strongly involved in. And it looks like in a way that's probably not that positive, but I guess it depends on perspective. So let's, maybe if there's time, come back to it. But just on the case of Coca-Cola, how the Gates Foundation really ended up kind of angering a lot of public health experts back in 2010 is that Melinda Gates gave a talk where she said global health organizations need to be more like Coca-Cola, okay? So they said that if companies, if nonprofits just tried to emulate Coca-Cola's excellent sort of supply chain and its ability to get sugary drinks into the deepest recesses of hard to reach terrain in areas of the most remote, far-flung corners of different regions of along the Amazon basin, for example. If Coke can do it, why can't public health organizations do it? Why can't they get their medicines to various places? And I think you could kind of see the logic behind her point, but this idea that we should be more like Coke really angered people because it had been involved in a lot of union busting activities throughout South America at that time, leading to its ban on a number of US campuses. Its sugary drinks were seen as being directly implicated in a growing obesity crisis. And most recently, I thought of that example of Be Like Coke when I read that Coca-Cola was one of the companies that the New York Times reported this week was involved in lobbying to soften a bill that is going through Congress that aims to crack down on the use of forced labor amongst Uyghurs in China. So Coca-Cola is actively trying to lobby against a bill that is trying to get companies to be more socially responsible when it comes to a reliance or a use of forced labor amongst Uyghurs in China. And so Coca-Cola, that's not an laudable, that type of activity, that type of antisocial lobbying activity is the exact type of company behavior we want to limit and restrain, not encourage. So I think the Gates Foundation, by saying we should all be more like Coke, confers far too much respectability on companies that actually have to be exposed as often negative actors when it comes to public welfare and health.
Well, let's get back to your Oxford example, then the Oxford vaccine. So presumably there, the substantive product in question doesn't have those negative connotations that you attribute to Coke.
Well,
So
you'd hope so. So let me describe this example. And I
yeah.
actually, I want to stress that when we talk about something like vaccines, it's such a tenuous area, because I don't want to give salience to any of the conspiratorial anti-vaccine conspiracies that are growing. And at the same time, I think vaccine hesitancy is a very real social phenomenon that has to be studied in a non-pejorative way in order to look at why some communities that have traditionally not been protected by states and have often been exploited by companies or states, why they might be wary of sort of the possibility of compelled vaccine efforts. So we really have to tread this line carefully. And I do salute the idea that vaccines are a crucial public health technology, but they also need to be affordable, both in developed countries and poorer ones. And so I'll try to be a bit more concise than I've been in some of my rather rambling responses, but let me try to lay out this case, which is a bit complicated, but which has also been, I think, quite usefully very well reported upon, including in the business press. And even some of the business press was a little bit critical of the Gates Foundation on this front, which was interesting. But what happened was that Oxford has, as you might imagine, as a leading university, a huge public sort of health arm, and they've had a lot of focus on developing a sort of vaccine that could immunize against some of these, SARS-related COVID-type viruses. And so they were very close to a functioning vaccine, and that was clear. And they had reportedly a plan to make it available without any exclusive copyright protections for any one company. That was apparently their aim. They had decided that because of the pressing health needs of the pandemic, they were going to provide it on an open license basis. And then Fortune magazine reported that apparently, we don't know really the details why, but this was reported in Fortune magazine. After some persuasion by the Gates Foundation, they chose instead to partner with AstraZeneca and to offer AstraZeneca an exclusive patent without any conditionalities when it came to pricing, but with the hope that AstraZeneca would make it as easily, sort of as widely available as possible. So, this received a lot of press coverage because people like Helen Clark, the former Prime Minister of New Zealand, partnered with a woman whose name is Winnie Byanyima, who's the current UN Undersecretary General. So it's quite a high position. They wrote an op-ed in The Guardian, really saying that this was a problematic move for the Oxford vaccine to have gone to AstraZeneca on an exclusive patenting basis, because this means we are now fully reliant on the goodwill of AstraZeneca to price this vaccine affordably. And what they did recently is they pledged to make it affordable. Once it's approved, it's now looking like it's one of the last of the 3 top contenders to be approved because of some safety concerns with this trial. But instead of an open license, it was reportedly after some negotiations by the Gates Foundation that they chose to grant an exclusive license to AstraZeneca. And as op-eds from people like Helen Clark, the former prime minister, and Byanyima pointed out, this just strengthens a system of really problematic monopolistic IP protections that actually in the past have driven prices of prescription drugs as well as vaccines through the roof, is increasing the costs of healthcare, not lowering it. And therefore, they really questioned why there was this decision to offer an exclusive license. And what I'm interested in is what exactly was the role of the Gates Foundation in this, and why did they choose to do this? Because ideologically, it is in line with their constant pro-patent position of sort of the past 20 years. But from a public health perspective, it was a bad move.
I've noticed that the Gates Foundation language these days has shifted a little towards the problem of distribution, where Bill Gates seems to be identifying distribution as the key challenge now rather than the science behind the vaccine, which seems quite interesting. And then I can imagine that what we are confronted with immediately, as you suggest, are the trade-offs involved. To maximize distribution, we perhaps have to start shoveling money to these companies, But I guess maybe what you're suggesting is that that's not a certainty. Perhaps there are other ways of maximizing distribution that don't require this sort of exclusivity and monopoly profit. Is that right?
Yes, there's many other ways of improving distribution. And certainly those ways do involve some level of having major companies at the table. They do have a vast ability to scale up. But for example, I mean, it's the Serum Institute, which is based in India, which has already been offered a sort of advanced contract for something like 1 billion doses. We need many more than that, something like 7.8 billion, really, if you really want to vaccinate the world. But you also can have a lot of what's called, generic drug capacity to manufacture at scale, as long as there aren't restrictions that are sort of sanctioned and governed by the World Trade Organization around manufacturing any intervention that has patent protections. So distribution is an issue, but there's many companies that are involved in generic drug development that would be able to be enrolled in the effort of manufacturing and distribution, and could be done so more at scale if there weren't legal barriers to them doing so that are ingrained in the WTO's TRIPS agreement, which is the trade-related aspects of intellectual property rights. So most recently, I think this is a really key point you've raised, because the line that, not just Mr. Gates, but most of the heads of, Western governments tend to take is that the patent system is functioning fine, and we just need to allow certain types of relaxation in cases of major health emergency. Well, South Africa and India have recently put a proposal to the World Trade Organization, which calls for exactly that type of relaxing of some of the stringency of TRIPS. They have said in the time of COVID, we need to allow companies to overrule any patent protections, ramp up their generic manufacturing capacity, and get any possible vaccines out. And that was put to the WTO in early October, and all major developed countries from the US to the UK to Europe, to coalitions and blocs that sort of vote en masse, they opposed it. And at that time, you had some other developing countries or sort of middle income countries, like say Pakistan, who said, we're not sure yet if we will support India or South Africa. We need time to look at it. And now recently they have announced that they are supporting India and South Africa's push. So you see actually blocks of challenge that the discourse of the Gates Foundation that says we have no alternative. Well, there is a clear alternative that is being put forward by many countries in the global South who insist time and again, we don't want more charity. We want a more just system of drug development and distribution that doesn't continually benefit Western nations. The type of patent protections that are in place today globally, these are the same exact types of copyright protections that a nation like the US just ignored while it was in, developing its own economy in the 19th century. So, I mean, there's been a long history of ignoring very stringent intellectual property rights in the past. But now that the US tends to be the beneficiary of scientific developments, it imposes a lot more stringent rules in other places than it actually abided by when it was growing its economy in earlier centuries.
Friedrich List
Canada, I'm Canadian, and we're bad too. We oppose this effort as well.
Well, we'll get to the Canadians and what's wrong with them later. That might be a different episode. There are people on this call who know the science way better than I do, but I get the sense that the lower technology, old technology vaccines that are being reworked and may come around next year may suit or may fit into a different kind of intellectual property paradigm and be much cheaper to produce and more convenient to distribute. And that in part, the discussion of these high-tech vaccines that we've been having in the last couple of months might be more specialized because it's sort of this new cutting-edge technology that has different implications. Okay.
It's something that, again, there's probably people on this call who are better placed to answer than I am. I'm going on the 3 top contenders, and we know that there's a very little chance that, Pfizer's been very adamant. They want to retain intellectual property rights. Moderna is said the same thing. And now the really one contender that might have had an open license was Oxford, and it gave its rights to AstraZeneca.
Right. You brought up this sort of American historical issue, which makes me think in the sort of grand historical terms, as a kind of historical economic sociologist, what you think this whole episode is telling us, or the whole rise of foundations in this way is telling us about, in a sense, about the state. I mean, if to deal with this situation, we have to invoke this new kind of power in these big foundations and their relationships to big drug companies. What's that telling us about the myth of the modern state as the kind of centralized problem-solving go-to device for protecting its citizens? Maybe that was kind of fake all along.
Oh, that's such an interesting question. I mean, there's been such a sustained ideological attack on the capacity of the states to care for its constituencies, coming from, a cross-partisan coalition of people who are, in some ways justly worried about different types of, overreach by a state. So, the spectra of totalitarianism was really strong in the mid-century. And for that reason, you can kind of see why people like Friedrich Hayek wrote these books that were so strongly condemning the idea of the benefits of a socialist economy. So from Road to Serfdom to his final book, The Fatal Conceit, he went on and on about the sort of what he called the weasel word of social, and how it's been contaminating sort of different efforts to, to create an infrastructure of a free market by assuming that, the government has the capacity to care for people effectively. And as we know, he launched this real epistemological critique of the central state and just said that because it can't access sort of different types of knowledge, the market system is the best way to price goods. And, he did it for, in ways, understandable personal reasons. He had seen sort of some of the negative effects of, National Socialism, certainly, and other types of totalitarianism in, say, Russia. But at the same time, he then really engaged in a sustained effort through his works through like the Mont Pelerin Foundation, and through his later work with Chicago School economists like Milton Friedman. He himself was at Chicago for a while. They kept eroding the capacity of the state to provide a basic level of support for citizens. And I think, so thanks to that ideological push, we've really reached a point where we don't even really respect the idea that a state that is tamed by a number of countervailing forces can be relied on to, at times, engage in really positive social planning. So of course, there are the horrors of something like National Socialism, but there's also been the rise of really beneficial public healthcare systems like the National Health Service in the United Kingdom, which is a socialist sort of public system, which has been really responsible for improving the livelihoods of a lot of people in the UK who are not likely to go bankrupt because of medical emergency, in the same way that people, frankly, in the US are at risk of, because there's simply not the same level of insurance for people. So I think the state can be a positive force, but there's been an erosion of its basic financing as a result of stagnating levels of public returns. We've seen an imbalance where returns to the private sector are starting to outpace returns to the public sector. I mean, that was the French economist Thomas Piketty's big point when he talked about a key driver of inequality has been that the private sector is growing more rapidly than stagnating public sector sort of returns. And so I think we need to have a rebalancing of the sort of attack on the state that took place over the past 30 years. And that rebalancing is not going to happen as long as you've got such business sort of saviorism coming out of reputable places like Harvard and then taken up by sort of somewhat beloved figures like Mr. Gates. But clearly he's now been at the sharper end of conspiratorial thinking. So I think understanding that is interesting, because why has he gone from being such a paragon of virtue to being such a feared figure? And I think it's because people actually are getting more suspicious of the business saviorism that he in many ways extols.
I can see your point, certainly, that the state could be doing a lot of this work well, but there feels like there's a bit of a gap between that and then the actually existing states in which many of us live and their obvious incompetence or malevolence or just absence on this. Yeah. So have you found it interesting to see how the state has and has not been able to respond in general to the pandemic?
Yeah, that's such a good point. I mean, when you lived in failed capitalist states, you forget that there are countries that aren't at our level of disarray and absolute near brink collapse. So the UK and the US, two of the most capitalist societies today, have been almost uniquely insufficiently prepared to address the demands of the pandemic. Whereas sort of countries that do have a lot of public healthcare systems that are functioning and strong, like South Korea, we're better placed. And these are democracies. These are countries with strong social safety nets, as well as a number of traditionally quite protectionist economic policies. So I think they are good democratic socialist models to look to, but maybe a little bit of Western hubris is limiting our ability to do that. Now, of course, you did have some European nations who struggled as well that would have been a bit less capitalist. And that's curious to try to understand, but I don't think any of them have had the same excess deaths as say the UK or the US. We are at the top of, the failure scale when it comes to excess deaths. And so I think that's just a sign of this sort of pro-market approach that was really ramped up in the 80s by both Thatcher and Reagan, created an ideological shift to the right that was followed and adhered to by Clinton and Blair afterwards that we really haven't gotten away from. Maybe we need a paradigm shift. We need to open the Overton window and entertain more ideas for how we can have more protective states that aren't trying to just expose people to the volatility of a market economy.
Right. So if you live
But
in a failed,
maybe I'm too optimistic. Maybe we need, I don't know, more drastic anti-capitalist efforts and smaller states, secession. Whenever I talk with people in the States, someone's always from California and they say the answer is just that California needs to secede and then we'll be fine. So I don't know. What do you think? Do you think I'm too naive almost about the capacities of the state to address the welfare of citizens?
well, I think what we're living through is showing, as you say, the kind of failed state, the failed version of the advanced capitalist state that we're living in. And in that light, in the current circumstances, people are rushing around looking for whatever tool they can find to help remedy the immediate problem. And that's why these foundations, Gates in particular, has such a prominent role to play, and it's kind of filling a void left by the state. And we can theorize all we want about the alternative to the failed state, but in practical terms, it may be the case that this is where the power lies, this is where the money is right now, and so this is the best choice for advancing against the problem immediately, which is not to say that we should ignore the implications and the side effects as you're suggesting. Those become even more important, absolutely. And I'm struck by the sort of more historical comparison. And I think about, when we think about Gates, should we be thinking about the East India Company and the way that, the state has always been kind of supported by or resting upon non-state entities that carry forward some of its politics or some of its desires. And thinking around the same time, it's really noticeable that what we're doing practically today before the vaccine to deal with the pandemic is pretty much exactly what people have done for centuries in the face of pandemic. It's the same as the London plague of 1655 or whatever, which is that people are avoiding contact with their neighbors, they're wearing masks, they're trying to keep to themselves. And our technology for responding to the pandemic is essentially the same as you read in the Decameron from the Italian city-states of the 15th century. These historical plagues, we haven't really done much that's different, regardless of what the theory and practice of the modern state might have claimed in the 500 years since then.
I mean, I think seeing continuities is so important, but I would disagree when it comes to levels of state social protections through things like statutory sick pay or furlough schemes that support workers. You've seen huge variances when it comes to the ability to self-isolate. So I think your point about we've mostly done what we've done in the past, which is try to keep to ourselves. of course, people who can and have the income and the capacity to work from home are able to do that. But we've seen huge variances with people who have that capacity. So unsurprisingly, studies in the UK have shown that people who earn less than £20,000 a year, which is not far off an average salary, actually, it's a bit lower, but not that far off, are 3 times less likely to be able to self-isolate. There's that type of concern that some people are particularly exposing themselves to the sort of risk of the virus. And it is a job of a government to protect that, but also to sort of mandate companies in ways not to expose their own workers to unsafe conditions. So this is where, maybe just to briefly, I know I seem quite critical of the Gates Foundation, but I do really think you have to look at where this wealth comes from. And a company like Microsoft was really at the sharper end of going towards the outsourcing labor boom in the 90s onwards, where it tried to make as much of its staff precarious as possible so that you're not having to pay different sick pay benefits or long-term benefits. And that's been a huge change in the US economy over the past 30 years, the increased precarity of most workers. And that's something that could be reversed. And there's will to reverse it, I think. But we have to find a language that will sort of put pressure on political actors to enforce that type of corporate protection at some level.
Yeah, this raises an issue raised by one of the questions in the chat here, asking about cultural differences between the UK and the US and Korea and others in their response. It sounds like maybe you'd be more inclined to see institutional differences, legal and tax system, health code differences as the explanation. Is that right? What do you think of how?
Yeah, I agree. Yes, definitely. I think institutions matter, and the perception of institutions. And I haven't been able really to see what's coming up on chat, but I did notice someone asked about Mariana Mazzucato and her view on the entrepreneurial state. And I absolutely love her work. I think it's fundamentally important. It shows the ability of a state, not just the ability, but the past history of the state to invest in sort of different types of infrastructure building at the scientific level, as well as the level of sort of healthcare support, is monumental. It's huge. Like the illusion that it's always the market that has the best, or the corporate sector that has the best entrepreneurs is just a myth, as her book exposes. So I do think, though, you need to get to an ideological level where you're actually capable of seeing the state as anything more than just a bureaucratic sort of basket case. You have to rethink your perception of the state as really lumbering and overly bureaucratic, because sometimes it can be, let's face it. But speed and efficiency is not always on the side of public safety or value. So sometimes taking longer to do something right can be better in the long end than rushing something to market before it's ready. It's like when I see our very conservative UK government crowing about we were the first to license a vaccine. That's just ridiculous. Anyone can be first if you cut as many safety corners as possible. And the FDA traditionally in the past has been quite a strong supporter of public health in ways that you can actually look at when you compare regulatory systems, which I mentioned earlier was part of my PhD project. So the FDA, in taking longer to approve this vaccine, that is a good thing. They're actually looking at all the raw data that the UK regulators were skipping over.
Yeah, there were some media reports that inside the White House here, they were mad that the UK might go first, and they were trying to figure out ways to go ahead of it. And I was sort of imagining, is it possible to root against both sides in a fight while still getting a vaccine out at the end?
And it really speaks to your question and good point about the limits of the state, because when states are just trying to serve the partisan needs of an incumbent power, they're not acting for the people. They want to just look good. So maybe they were actually really saying, oh, this vaccine needs to get out to the people. But I think it was more like they wanted bragging rights on who's first.
Right. We've had, in this series, we talked about the WHO quite a lot. And the Gates Foundation obviously appears in that conversation as well, because it is probably the second largest funder of the World Health Organization's operations. And it's an interesting example in that institution of the kind of blurred line between states and public authorities and then private actors, because so much of what the World Health Organization does are these projects that are kind of funded by a donor. It used to be a state donor, but now it's also foundations, where the donor comes to the organization with a particular project. So a malaria project in place X, or a public health program somewhere. And in a lot of what the WHO does, you see all these programs, and it's very hard to get a handle on where the money is coming from unless you're an insider. But on the inside, it's quite clear that certain programs reflect the wishes of certain donors. And it's almost indistinct whether that's a member country or the Gates Foundation or a similar entity.
Yeah.
Rephrase as a question as needed.
No, it's a really important question. And I mean, there are other people who have done sort of much more comprehensive work on the WHO. I mean, you know, you're saying it's hard to get a sense of what's going on. I mean, I sat in the WHO lobby, you know, at least 10 different times, and people would sort of sneak out and come speak with me and sort of say, I don't want anyone to see that I'm speaking with you, because I shouldn't be speaking with you. Like, that was sort of how my field work was done. And so really, I didn't get to know that much as I might have liked about the WHO, except this little lobby area outside a cafe that's sort of on this sort of just below the ground floor area. But yeah, it's like any large organizations. It's incredibly complex, but there has been studies that show that traditionally, you know, the WHO is reliant on agreed sort of funds that are determined or, you know, lobbied for at places like, you know, annual, you know, sort of through you know, relied upon channels. But the US has always been the largest funder traditionally. But when you look at what that amounts to, I mean, you're looking at about $1 billion annually for the past 10 to 20 years, and the Gates Foundation gave 500 million. Okay, so it gave $500 million, and that positioned it to be the second highest donor. And that might seem like a lot of money, but on the grand scale of how that compares to the health budget of, say, the World Bank, it's actually a lot less. So the World Health Organization is often in the firing line of being at the front line of sort of relied on when it comes to pandemics and sort of relied on for expert guidance, but they operate on a bit of a shoestring. And increasingly, when a state gives traditionally, it's known as what's called an assessed contribution. And that means that they can go into general WHO sort of funding decisions in a way that doesn't have to be determined by the donor state. And then there's a rise in what's called in sort of discretionary lending. And the discretionary lending can be given for specific purposes outlined by a donor, whether it's a philanthropic organization like the Gates Foundation or whether it's a state. And over the past 30 years, the proportion of money that's going to sort of discretionary expenditures has increased relative to assessed. And people think that that means that the WHO is increasingly reliant on these discretionary funds that have to be responsive to a donor's aims and desires, rather than the expertise of the World Health Organization when it comes to making its own internal budgeting allocations. And so, yes, the balance of money that comes, as you put it, from donors making their own voluntary but stipulated requests for how those voluntary expenditures are allocated has increased proportionately to the ones that are known as assessed and just go into the general operating budget. And so people think this has made the WHO too reliant on sort of darling pet projects of someone like Mr. Gates, whether it's something like polio eradication, which sounds great at face value. Who doesn't want to get rid of polio? But actually, when it comes to global killers, polio is not up there. And a lot of developing countries think, God, why are we spending so much money on this when actually diarrhea is a much bigger killer annually?
You mentioned the Koch Foundation. One of the questioners in the chat is asking about the Ford Foundation. I wonder, as you survey the landscape of these foundations, are there others that we should be thinking about that we don't pay enough attention to?
It's a good question, because when it comes to endowment size, the Gates Foundation's endowment is at about sort of 50 billion. And so it really dwarfs most other organizations, foundations, but not all. Like the others are more in the range of sort of 10 billion. And I think many of these organizations, the money can come in handy often. It is good. We are at a time where we need all the money possible to relieve some of the suffering that is ensuing from the pandemic. But I think there tends to be, you know, the fancy word you would know that sociologists use is sort of obviously institutional isomorphism, where an institution gradually becomes incrementally more like a dominant organization because of sort of mission creep or the emulation of best practices, even when those practices aren't great. So at Ford and Rockefeller, you have also seen a real embrace of the type of pro-business, let's marry profit with social purpose sort of rhetoric and practices that were coming out of Harvard Business School. So all of these organizations have kind of gotten onto this bandwagon. And only now people inside the philanthropy field are starting to say, oh, maybe this wasn't the panacea that we thought it was. And you're even seeing really pro-business outlets and journals, like a key magazine in this field, a journal. It's sort of, it would be an academic journal, but it's also got, it's a bit like Harvard Review of Business. I don't know how well peer reviewed these things really are, to be honest. They often seem like, it's like, who's reviewing this? Any sort of Fortune 500 company, is this who's reviewing these things? But anyway, so it was called the Stanford Social Innovation Review. And the Stanford Social Innovation Review was kind of like a organ of shared value and the shared value approach. But recently, they just published an incredibly critical article on shared value. So even some of these journals that were really dedicated to the sort of business saviorism that was coming out of Harvard and elsewhere have now started to backtrack a bit and say, well, inequality is rising. Growing deprivation is a clear problem. Maybe this direction was not the best way to go, and they are critical of it.
Yeah, you've raised this sort of theme in a bunch of different ways about the kind of taken for granted mindset and the narrative that gets attached to a certain way of thinking, which gives me a chance to ask about your more recent book about the kind of the use of ignorance and kind of taken for grantedness and gaps in governance and among elites. Do you want to talk a little bit about that? I'd love to hear more.
Yeah, well, you just described it so well. I think that was a beautiful summary. Yes, a lot of my work, essentially theoretically, is looking at, it's rooted in this field that has come to be known or described as ignorance studies. And ignorance studies is a very cross-disciplinary field that tries to argue that actually a will to ignorance is not necessarily always an aberrant or a deviant type of aim or institutional goal. Actually, not knowing different inconvenient things can often be a source of power. So for example, when you look at companies and supply chains, you are obligated to act on sort of abuses of labor if you know about them in a contractor way down the supply chain. What does that incentivize? Turning a blind eye to any type of reporting or protocols that might inform you of information that you actually don't want to know about. And you might say, oh, well, do companies really get away with this? Well, yeah, they get away with it all the time. And that's been documented, that's clear. But we haven't yet gone from recognizing that strategic ignorance being a socially useful sort of power to really theorizing it. So I think my work is trying to go from looking at, is there an incentive not to know inconvenient information, and saying, yes, there clearly is, to then trying to understand it in more detail. And it's not always as pernicious as this or as conscious. It's also trying to call attention to the fact that nobody is omniscient, and even sometimes their education might lead them to be more knowledgeable of different areas than they are. And I think that's the problem with someone who's clearly well-intended. I think Mr. Gates is clearly well-intended. I think he's got a big heart and is trying to do well, but he is not as knowledgeable about the limits of capitalism than he thinks, and he doesn't seem very interested in educating himself about the ways that capitalism can actually create a lot of inequity and sort of vulnerability either. And you really saw this in February when he said back in February, nobody would have known at all that the US would have been so unprepared for a pandemic. Many people would have known that the US was uniquely unprepared for a pandemic because they would have looked at things like sick pay provisions, levels of household savings that could be drawn upon in an emergency, where the US, a great deal of people could not find $400 in an emergency if needed. That's been reported for years. So yes, a lot of people could have known that the US, despite being wealthy, had such inequities within it that it was really quite well positioned to be poorly prepared for the pandemic. But Mr. Gates doesn't realize that, because I think he associates the wealth of an overall country and his own wealth as a sign of sort of the health of the nation. And that's simply not a plausible deduction to reach.
So in ignorance studies then, is the field interested in the kind of strategic use of ignorance or its production, or how do you think about it?
Both. both. I think that's a great question. I mean, to my knowledge, I'm pretty sure I started talking about strategic ignorance in 2007 in an article I published then, so almost 15 years ago. And to my knowledge, this is the first use of that term in sociology and sociology journals, but it had been used elsewhere in psychology before. And at the psychological level, people tend to define strategic ignorance as a very individual phenomenon where you willfully don't embrace any facts or information that might disconfirm an earlier ideological position. So you can see this across the political spectrum. I think we're all guilty of it in ways. We don't like facts that force us to rethink an earlier ideological assumption. But I argue that psychological way is too limited a way to look at strategic ignorance. And you also have to look at the institutional capacity for organizations to organize themselves in ways that systematically produce the ability to say that they didn't see an internal problem or an external one with their own operating practices. So I define it as the ability to exploit the unknowns in an environment. And that ability is often one that can rely on different governmental or corporate infrastructures that allow you not to know inconvenient things.
So is it true then that as legal accountability goes up, the incentive for ignorance goes up as well?
Very much so. That's such an eloquent way to put it. And I devote a whole chapter of my recent book to that very question of legal accountability.
It seems like a great way to understand some of these companies that hire a legal firm to investigate their sexual predation or whatever inside the firm and magically make problems disappear.
Exactly. And I've wondered about that because my book doesn't look at all about this problem of things like sexual harassment, but I know a lot of other people are starting to talk about this and saying this is clearly a key role for ignorance studies to try to address a key empirical area. And other, clearly a lot of work in, feminist theory, there's all the sociological work actually on ignorance is really indebted to earlier feminist scholars as well as critical race scholars like Charles Mills, who talks about the problem of white ignorance, how systems of cultural advantage are often predicated on the powerful group in that realm not wanting to admit the ways that its power disadvantages other people and is actually reliant on the suspension of rights for other people. So it's really important, I think, to acknowledge that predecessor sort of strand of literature coming out of philosophy, really.
It's a really productive term. And if you coined it for sociology, I hope that you trademarked it so then you can invoke the TRIPS intellectual property protections and profit from it.
Yeah, well, I am very hypocritical that way. I do try to be proprietary over the terms even as I'm criticizing other people, yeah.
Great. Well, this has been fantastic. I really appreciate you taking the time. It's a great introduction to everything that you're doing.
Thank you so much. Thank you for the great questions in chat that I've been taking in. And if anyone wants to ever extend the conversation or write me an email, I'm always keen to be in touch with people across the pond, as we say.
The Canadians don't say that. So that shows that you've acclimated.
Yeah, I'm forgetting my cultural roots.
Yeah, you've lost it clearly. Well, thanks a lot. And thanks to everybody for coming. So this is the last in our series of talks for the COVID and Global Governance project this quarter. But we will be posting a collection of online essays in a symposium in the next little while that comes from our solicitations from a bunch of experts on a bunch of fields, talking about how the COVID epidemic is revealing something new in their field that they're interested in understanding. So keep an eye out for that on our website. Great. Well, thanks, everybody.
Thank you.
Take care. Bye-bye.
Bye. Thank you.
Thanks, Linsey.
Thank you.